dear friends and colleagues, to this very special event on strengthening health data governance in the digital age. It's a great privilege for me to welcome you here. My name is Christoph Ben. I'm the president of Transform Health. And it's really kind of a very special occasion. I think the level of participation here in the room, but also the many people who join online, demonstrates that this is obviously a very important topic that we are going to discuss here today. And obviously, we are also meeting at a very particular moment in time, if you like. We are here in the week, of course, of the UN General Assembly, but also of the Summit of the Future. And many of you will have followed probably early in the week when the Pact for the Future was approved, and as an annex also the Global Digital Compact that is also talking about data governance. So we know this is a very important topic in kind of global international conversation right now. And I'm very pleased that Transform Health is playing a very important role here, because it's one of the few platforms that really brings together a variety of stakeholders, including civil society, with a truly kind of global footprint. And so congratulations to the team, to Matilda, Kirsten, everybody who prepared this event. Yeah, I think a clap is in order. That has gone into preparing this event, but even more so, of course, for your role that you've been playing on promoting the data governance in the digital age, over the last few years. This event is not organized only by Transform Health, but it is the event that many partners have been contributing to and are co-hosting this. It's also WHO, it's the Health Data Collaborative, it's OECD, it's PATH, it's the Partnership for Maternal and Newborn Child Health, and very importantly, also the Young Experts Tech for Health. And I think you will hear from representatives of all these partners also later in the afternoon. So we will jointly explore perspectives, approaches, opportunities to strengthen the governance of health data with the aim of building stakeholder and political support and consensus around needed action. And all these elements are extremely important, but particularly also the political support. And that's why I'm very pleased to have ministers here, to have high representatives of several governments, because without your support and putting that also into the legislation of your countries, we could not succeed. So welcome to all who are here to advance this agenda. The event is structured around two different panels. The first panel, we will hear personal and community perspectives on what health data governance means, and perspectives then of governments and other actors in this regard. And the second panel, we will hear about national experiences and commitments from leadership. But before we turn to these two panels, we would first invite the keynote address from a dear friend and colleague of Transform Health, Dr. Derek Munine, from the WHO Department for Digital Health and Innovation. We are particularly pleased to have you here, Derek. You've been following Transform Health from the beginning over the hardware. We are delighted to have you here with us to give the opening comments. Please, Derek, the floor is yours.
All right. Thank you very much, Christoph. As you can see, I've to adjust the mic to suit my height. But really want to thank, personally, Christoph Ben, for your tremendous leadership in this area. As Christoph mentioned, right at the beginning of the journey around data and digital, we actually had worked with Christoph Ben and his team to really iron out the issue of costing digital strategies. What does it take to actually lead the transformation of the digital health agenda? And so there's a report that Transform Health produced that we've been using as a framework to really encourage countries to move from good intentions to costed intentions, really ensuring that the strategies that are built have a robust M&E framework, but also a robust costing framework. So, honorable ministers, distinguished participants, ladies and gentlemen, it's my pleasure to be giving this keynote on behalf of Dr. Samira, our Assistant Director General, and also on behalf of the team that is shepherding the work on data at WHO. The issue of data and digital usually goes without saying, but more often goes without doing. And that's why others have likened data to be like the oxygen. We do not see the value of oxygen because it's abundant, we take it for granted. But when it's missing, then we start panicking. Before coming to UNGA, our aviation office gave us an analogy of the role of data within aviation. And it was quite revealing to me because they made the case that each time you pass through the airport, you have no idea how much data we generate behind to inform the pilots of the paths, navigation paths, weather patterns, and etc. And so the back office goes unnoticed. But the moment we shut down our systems, aircrafts cannot land. And so they liken the data responsibility to the oxygen that we breathe. So it is with health data. The moment data is missing, as we saw during the pandemic, then we realize that data investment in data systems, both paper and electronic, are actually critical. Now, at WHO, we have been keen to support our member states with appropriate data governance frameworks, as well as appropriate digital health frameworks. There are 5 principles that our data principles articulate. They include the whole issue of treating data as a public good. They also include the whole issue of trust. They include the whole issue of addressing availability, including the appropriate use of secondary data. Those principles also include the whole issue of capacity building of our member states to be able to go through the spectrum of data transactions from generation to collection to analysis to presentation and decision making. Those principles also include WHO's role together with our ecosystem to fill in the gaps, especially now in the age of artificial intelligence. So where data is insufficient, we look towards artificial intelligence to help us to model those data sets that are needed for decision making. These principles look clear. They usually go without saying, but more and more we see that the key issues around being able to ensure that the data is usable, being able to make sure that decision makers are able to use the data for decision-making processes. These are key issues that we like to address. From a digital perspective, we see that the whole issue of the digital transformation is very neatly tied to the whole issue of the data revolution. At WHO, we are pleased that our member states have given us a global strategy on digital health, this document 2020 to 2025. This particular document has a firm foundation of the place of data as a public good, including the whole issue of data stewardship and ownership. We're thankful to our member states for really putting this particular document as a means by which we achieve the transformation, both from the data perspective, but also from the whole issue of using digital solutions effectively. In the age of artificial intelligence, WHO has also stepped forward to ensure that we're giving appropriate governance. We've released about 4 guidance documents on AI. From AI governance, we've also produced a training course to ensure that countries are able to harness emerging technologies such as artificial intelligence. But these technologies are nothing without capacity building, without awareness, without partnerships, without scale platforms to share exchanges. This is a more reason why WHO last year and this year released an initiative called the Global Initiative on Digital Health, which is a partnership forum, a partnership platform that complements the work of existing structures such as the Health Data Collaborative or the SDG 3 Action Framework. We are keen to ensure that the transformation we're looking for, both from the digital and also from the data, connects with countries and that countries are supported in the data transaction that they're looking for. Dr. Samira has always emphasized the whole issue of putting countries first. Whatever we do, where is the face of the country? All the good conversations that we're having, how do they connect with country priorities? How do they advance UHC? And more importantly, how do they connect with the people that are, producers and generators of this data? So as we engage in these important conversations, WHO would like to stress its support in terms of the deliberations of this meeting, but also WHO would want to make sure that key questions that remain, such as data sharing policies and principles and making those available, the whole issue of making sure that the individuals that have access, the right to access the data, actually have that data access. Issues around safeguard, around cybersecurity, issues around ensuring that learning machines that require data availability are able to harness the data. These key issues would like to ensure that are addressed in this conversation, but more importantly, want to ensure that we are supporting all our partners that are contributing to the transformation of the revolution, both on the data and also on the digital side. We thank all the organizers that have put in place this particular meeting and would like to show our commitment to our member states, to our partners, that WHO stands behind the conversations that will take place today. With these short remarks on behalf of Dr. Sumia, I would like to relinquish the floor and then hand over to Christophe. Thank you very much.
Thank you so much, Derek. This was a perfect introduction to our event here. And obviously, the collaboration with WHO is absolutely essential for Transform Health and the whole network that Transform Health stands for. And we are very grateful for also the openness of WHO that you've showed on many occasions to work with Transform Health. And it's, I think, indeed, mutually beneficial, this partnership. So thank you so much for that. Now it's my particular pleasure to welcome a very special person here, the Executive Director of Transform Health, Mathilde Forslund. She has really been a formidable driving force of Transform Health from the first day, basically, building this network, building the secretariat. Mathilde, it's a great pleasure to welcome you and to introduce your topic to the audience. Thank you.
Thank you. I have to bring the microphone down even further, so I hope you can all see me because I'm not very tall. Thank you so much, Christophe, for those very warm welcome, and thank you to Derek for the beautiful keynote remark. And yeah, we really do appreciate the collaboration that we have with WHO and the Health Data Collaborative. And I think the fact that we've got here is a testament to the partnerships and with all the other co-hosts and partners also that have been part of this journey over the last few years. So thank you so much. So ladies and gentlemen, distinguished guests, speakers, thank you for joining us here today. I know it wasn't easy to get here. It's across town from the United Nations. So to the many of you that have made it, we really do appreciate it. And I think it's also, as Christophe said, a testament to how important this issue is at the Summit of the Future, at the UN General Assembly this year, and how passionate we all are to drive this agenda forward. So for those of you that don't know Transform Health, we're a global coalition of 200 organizations that are advocating and supporting the digital transformation of UHC to achieve universal health coverage by 2030. Digitalization and the use of digital tools have become an integral part of health system and health service delivery. And I don't need to emphasize that here. I think we're all practitioners in that space. As we all know, the digitalization has also exponentially increased the generation of health data. Health data is a vital asset and the foundation of 21st century health systems. And it particularly is important because it enables artificial intelligence, it supports digital transformation, it advances research and innovation, improves data-driven decision-making, supports healthcare professionals, strengthens equitable and resilient health systems, improves health emergency and pandemic response, empowers individuals to achieve their personal health goals, and ultimately enhances the care delivery and outcomes for us to achieve universal health coverage. So data is at the core of achieving UHC. But in order to achieve universal health coverage, we need health data to be effective and equitably governed for all, including through a robust legislative and regulatory environment to ensure the right protections are in place to safeguard data privacy and rights and mitigate risks of data misuse while also supporting responsible data use for public good. So today's side event takes place just a couple of days after the endorsement of the Digital Compact that has been endorsed by governments, which we really welcome, and we really welcome the strong focus on data governance in the Compact. And this really sets a strong foundation and commitment from governments and representatives, and is a critical opportunity to for us to galvanize action to support this important issue. So we encourage governments to prioritize the development and endorse a health-specific health data governance legislation and regulation. And this is the work that we've been doing for the last 3-4 years. First, we launched the health data governance principles in 2022. And then more recently, we have also been working on a model law, which I'll come to in a bit. So the importance of seeking an endorsement for a health data governance framework through a World Health Assembly resolution and regional mechanism, we believe would help build consensus across countries and stakeholders around essential areas that should be addressed through national legislation. It would also establish a level of compatibility in national approaches to foster greater legal coherence across jurisdictions. And importantly, it would also provide a resource to support governments in strengthening national frameworks. This would also help take forward the commitments in the Global Digital Compact and recommendations in the report of the AI Advisory Board. So towards this end, Transform Health, along with our partners at the OECD, the Africa CDC, the Health Data Collaborative, and also some of our regional partners that we work very closely with, regional networks such as AHIN, Helena, Rekinsa, and also our young experts, Tech for Health, which we're going to hear from soon. We have been working with legal experts to support the development of a draft model law on health data governance, which we believe would serve as the foundation for a global or regional framework, ensuring that this is also underpinned by the equity and rights-based principles that I mentioned before that we launched in 2022. The model law provides a blueprint and a legislative guide and resource to assist countries with their efforts to strengthen national laws and frameworks dealing with health data governance. It is not meant to be prescriptive or imposing, but rather provides a flexible framework that can be adopted to suit different contexts in different countries. It has been developed through a multi-stakeholder consultation process, engaging more than 1,000 organizations from across the globe, including several national consultations that have been led by ministries of health. And we are now working with partners and governments to explore the practical implementation of the model law across 6 countries, including Cameroon, Malawi, Rwanda, Senegal, Uganda, and Zambia. So it's my pleasure now to invite Carol. She's the president-elect of HELENA, the Pan-African Health Informatics Association, and she will make a few remarks on this process in implementing and testing the model law in Malawi, Rwanda, and Uganda.
I need to adjust my thanks, Matilda and Ben. The model law, like Matilda has mentioned, has been developed with multiple consultations at the country level. And it is because we do appreciate the fact that different countries have different contexts when it comes to governance structures, when it comes to privacy of health data within the countries. So we went as far as community engagement, where we even consulted the community health workers, what they think about the law and their input. We also involved civil society organizations because we believe they have really a strong advocacy bit when it comes to health data governance. And right now we are going into testing the implementation of the law. And the roadmaps are going to be developed and shared with countries on how countries have actually adopted the health data governance law. And like she mentioned, it's not a prescriptive law. It is meant to support countries to strengthen their health data governance. It is also meant to support countries that do not have these laws in place to develop them. So we are really looking forward to a very, very tedious process in testing it, because we have already seen this through its advocacy and creating awareness. There's been some bits of resistance, where countries think that it is a new law being developed, but we do know that health data needs governance and these policies need to be put in place. So through its testing and of the implementation, we hope to pick lessons which we'll be sharing at later platforms at a later stage. And also, eventually, we hope that the WHA next year will endorse it. Thank you.
Thank you, Kara, for sharing that with us. So just to move us into the panel, I just wanted to say a few final words and just really emphasize that government leadership is really critical to move this agenda forward and to get and seek endorsement for a global and regional framework for the governance of health data. So we are pleased to have many governments here today that have shown commitment to this agenda over the recent years in particular. And we encourage governments and other stakeholders to prioritize at upcoming moments, such as the World Health Assembly, such as the Africa Union Summit in February, to advance discussions and turn recent commitments into action, including through the G20 and other platforms as well. And to champion the development and endorsement of a global and regional framework, including the model law as a foundation for this through a World Health Assembly resolution and other regional mechanisms. And we really look forward to today's discussion as a key next step to take this forward. And yeah, and I'd like now to invite Caroline to take us to the panel discussion. Thank you.
Thank you, Mathilde. Good evening. I am delighted to be moderating this session. We have a very distinguished panel. The speakers have spoken about asking government to endorse data governance. But before government endorses, we have to think about, what do communities think about it? Has anyone used it? Have they tried it? What is their experience? What is the feedback from the community that governments can take into consideration as they think about this model law? So I would like to invite my panelists. Please come forward as I introduce them. Roderick Rugishagwe is the Acting Executive Director at INASO. He works specifically with TB, HIV, and sexual and reproductive health programs across East and Southern Africa, and he is on the board of Stop TB Partnership in Tanzania. Next, we have Petrida Paul. Petrida is a member of the board of directors at Imara Leadership Initiative and a co-chair of the Youth Workstream, RBM Partnership to End Malaria. She received a Commonwealth Point of Light Award from Her Majesty, the Queen Elizabeth, for her voluntary work to campaign on her campaign to end gender-based violence in the Commonwealth. Next, we have Shannon Tom. She's a member of the Youth Experts Tech for Health, Yet for Health. I love that acronym. Yeah. Shannon is a health professional and a health equity advocate with expertise in health communications, policy, and project management. I don't know if our fourth panelist is here, Anusha. Yes. Yes, thank you. There you are. So Anshu Mohan is our fourth panelist. Anshu is a senior strategic advisor with PMNCH. Before joining PMNCH, Anshu was with the Ministry of Health and Family Welfare in the government of India, where she developed and led the implementation of a multi-sectoral program for one of the largest cohorts of adolescent population in the world. Anshu also served as the advisor and international partnerships for the government of India. So without further ado, I would want to go into the questions section. Hopefully we will have some time at the tail end for some questions from the floor. So please, with your questions. So Roderick Mugishwa, Your organization, INASO, has been involved in the My Data, Our Health campaign. Why is this campaign important? What does the campaign hope to achieve? And what is the community's response when you did this campaign and around the broader issue of data governance?
Thank you very much for the question. I hope you can hear me. Of course, INASO as a regional organization with an advocacy role to ensuring that communities have capacities to participate in the response to the pandemics. Data governance we had our My Data, My Health campaign, the purpose of creating awareness among communities to be aware of how their record how it is being used, and what is it for, how can they benefit from it? And there are lots of experiences around people being denied even accessing their own data. And so because of that, we needed to create that awareness so that they are aware that when the information is communicated, that is very crucial in terms of shaping policies. When government are making budgets, they need data to do source allocation. And also terms of also ensuring that there is access to essential services that are available, so need that information. But in terms, most of the time, this information is attempted being used. And when it is being used, as communities feel that there are issues around. I've been working in the especially HIV and TB space previously is very crucial. And sometimes some find that there are issues around stigma and discrimination that is related to data privacy, because someone feels that if I go to a certain facility, my information will be leaked. There are instances of people being treated they travel for hundreds of kilometers to get access to services somewhere just because of that, the issue of privacy. So this was a very crucial campaign to ensure that, first of all, communities are aware when we talk about the data and privacy, what we mean, looking at also what are the existing structures, what are the policies in the specific countries that exist that governs around data, what communities can do to ensure that there's privacy, how that is being managed, and also to be able to ask for questions, going to the facility. I personally, I think at one point I remember I had some medical emergency and I was traveling and I needed that information to help me as I travel so that I can monitor them. But the facility couldn't give me that information until I read the director. So the question why do I have to ask for permission for my own health information? Do I have any agreement with the hospital to say if I want this information, I can get it? So there are quite a lot of issues around that. And this was a very critical moment, especially for the community, because they are not aware. This is how they could navigate around. So that's how the community felt that this was a very important time to start discussing around this.
I like the example of the people who travel far, so that they can, that is their way of protecting their data. So they may not be able to articulate and say, I need data governance to protect me, but their behavior is asking for action so that they can be able to access the services that they need. So I think this brings me to my question for you, Katrina. When we talk about, you have also been involved in the My Data, Our Health campaign. And when we talk about data governance, what does it mean to you? What does it mean to local communities in Tanzania when they hear data governance? What are some of the concerns that they have that can be addressed by putting data governance issues at the front and center?
Thank you for that. I hope I'm also audible. So ideally, when we were implementing the My Data, Our Health campaign in Tanzania, it was not all about just implementing a project, I would say in particular. We were more into mainstreaming the campaign into ownership and sustainability by the people themselves. So ideally, it was focused on ironing out the issues of health data governance. And what we experienced as a country is, first of all, we all know that digital health data I might say it might be an African issue, but also it's a Tanzanian issue. We are not in the same pace as the Western countries, and we are trying to be at that pace, which is a bit difficult. So first of all, we do have the national strategy, digital health strategy, which is expiring actually this year, 2019-2024 in Tanzania, but we're more also focused on ironing out what are the gaps. We have a lot of AI-related upcomings that are coming up, but also we have a lot of issues around centralization of data. I come from a community where I have to fill in a lot of paperwork when I go to a hospital, and I wouldn't get that same information if I go to another hospital. And most of the times you get issues of network. The computers never work. I don't know why. But apparently that's how the system is, and we have to abide to the system. So one of the biggest concerns that we observed is majority of the people are struggling to get their health data information. I myself am struggling to get my health data information, being the fact that there's no central system to access the information. You have to do a lot of paperwork each time you visit a health facility, and which can be a huge challenge. And this also causes a lot of misreporting and misinformation. I can go to one health facility and tell them I have this particular health issue, but they'll say, no, we have to start with the scans all over again. And this brings to the point where it's going to be more costly, and some health insurances don't cover a lot of this. So we actually decided to iron out the issues that we're facing in the digital health space in Tanzania by working with parliamentarians, but a lot of work was done in conjunction with young people, because we know that young people have the power to advocate and mobilize through social media, while parliamentarians obviously have the role to influence decision-making processes. So through that, we managed to actually do a lot of research, desk work, surveys that we also involved the Ministry of Health itself, and develop an online actually health data governance manifesto. And some of you might ask why online and not offline. Basically, it's because of the accessibility to it. We'd rather have a document that a minister might flash on his or her phone and just scroll through certain information, rather than have a lot of paperwork that might take a long time to be delivered to the minister due to the lots of protocols involved. So ideally, the health data governance manifesto that we developed in the country was more in alignment to iron out where are the gaps of each digital health platform that is established by the government through the different partners, and also lay the foundation for the recommendations on the new national strategic plan for the Tanzania digital health strategy. That was one entry point, but most of the work has been through the parliamentarians, because they have a huge role to play in the country and influence decision-making processes. So we've actually have one of the parliamentarians who's championing for health data governance in the country, and we are actually working with them to ensure that there can be change of policies. I mean, we do have systems in place. We do have good documents and statutory documents in place in Tanzania. It's the implementations and the facilities that brings an issue. And I think one of the other concern that we are looking into is the fact that how do we have different partners on board to actually invest on the system that can be used for digital health data. We may talk about lots of issues, explain a lot of matters, create a lot of manifestos, but if we don't have the right infrastructures, we're as good as stuck. So currently we're still also amplifying the campaign to ensure that we work on seeing how best we can have different tech companies work with the government, but also have the government itself actually know how best to digitalize the health information, because currently the data that is accessible to some health facilities is only, I'll keep it the posh hospitals. We have a lot of hospitals at community level that don't even have computers that I just mentioned earlier. So I think there is that huge digital divide for some of us. But I think it's more around how best can we really invest on infrastructures through the campaign to help ensure that we have a lot of investors in the country, a lot of capacity building in the country, so as we can ensure that health data governance itself is understood as a concept, but also is actually practiced, and it can actually reach the furthest the most, because I'll really keep it as blunt as it is. We really have a lot of challenges when you look at a country in Tanzania. Internet itself is a challenge. And I say I'm part of the privileged community that I can even access internet. So how can we ensure that when we talk about the digital space, we create platforms that even those who cannot have access to them can actually have access to it? That's all.
I like that challenge. How do we move from policy to practice, from talk to action? But you also bring out a really important point, the comparison between low and middle income countries and high income countries. And I think that, Africa, we have the fastest growing digitally native population. So if we're talking about who is the majority of Africa and how do they access services, whether it's health services or other services, it's through digital. And I think, Shannon, you can provide us with an example from your experience. You have worked with the Where Is My Data campaign. So maybe tell us a little bit about that campaign and some of the things that you saw and learned.
Yeah, absolutely. So I will just first of all say that Yet4H, Young Experts Tech for Health, is a global network, but I myself am based in Toronto, Canada. So I went through this campaign action for the Where Is My Data larger campaign to kind of go through the process of requesting my personal health information. And I knew, broadly speaking, that the Canadian healthcare system is actually quite paper-based and reliant on fax machines, actually. If people in the room still know what fax machines are, I barely do. But what I really learned in walking through the process of trying to access my health records was that in my home province of Ontario, patient health information is split into 6 categories, and that data is held by 6 different government bodies with all of their own processes and steps to actually request and access the information. So for example, your primary care information is held in a different place than your hospital records, and that's held in a different place than your test results and scan results. And one of those examples, so to access my test results, and is this helping? Okay. So to access my test results and my scan results, I had to actually know the specific tests that I had gotten and the dates of each of those tests in order to access the records, which for me was not possible without the records. So definitely an eye-opening process. Something I can speak to as well is sort of what I've heard in my Yet4H capacity from other young people as far as health data governance. So what we've heard is that young people are generally very interested and ready to get excited in this topic. And our goal is really to kind of open the door to youth engagement in health data governance and digital health. So in addition to kind of that importance of easy access to your own health information, we hear that young people also really value informed consent. So understanding what they're agreeing to when their data is held by an institution or by a body, as well as privacy. So making sure that it's well protected. We hear from young people that there are, of course, power imbalances in the data ecosystem that make it increasingly challenging to get involved and to speak up. And one of the things that they're asking for is youth-focused training and capacity building. So that's another way that Yet4H tries to kind of support youth involvement and youth engagement. The last thing I'll mention is that young people, have told us loud and clear, and I think this is sort of not surprising either, that their views are not homogeneous. Young people have a very, very broad diversity of experiences. And so I can speak to my experience, but it's hard for me to even speak for young people in my neighborhood, let alone my country, let alone the world. So it's really, really important to have as many young people as possible involved in these discussions.
So I think we've heard the perspective from the community and what some of the community members need. some of the challenges in accessing data, technology, and infrastructure, and then the diversity of what young people want. So for you, Anshu, from a data governance perspective, are there particular issues and concerns when it comes to women and girls?
Thank you very much. That's a good one. I'm finally getting my words back. It's a little unfair, you know, my colleagues have to speak much more loudly. So in the interest of equity, I can turn the mic off. But yes, but thank you for that question. And I'm very pleased to see that DG Somalia in the room here. He's a hero for us for championing the PMNCH resolution, and was much applauded at the PMNCH accountability breakfast. So, absolutely. Very much privileged to be a part of this conversation. And Matilda, you set the scene very much when you said that, you know, we don't have to work in silos. This is an intersection. We need to bring it together, and especially for women and girls, a section of population that is immensely vulnerable, and also, but I say immensely vulnerable, it's because of the inequitable access to digital instruments, inequitable access to cell phones, and also even employment. Women don't have the money, very frankly speaking, to go out and buy internet or have cell phones. Also, in continents and countries like ours, I come from Asia and of course Africa, there is an immense gender gap there. So, however, having said that, you know, the glass is half full, not always half empty. You know, we have the UNC, which is a huge instrument, you know, and if we integrate digital initiatives and digital means or digital health into the UNC as a platform, we can go miles. You know, we can make sure that girls and women have access to their health data. They're able to also, you know, have real-time information treatment. Also, it becomes very important in areas where you don't have GPs or you don't have doctors. So digital health initiatives like online consultations or online prescriptions can help, and these can be life-saving. So very important to integrate. But there are always pros and cons. And I think, Petra, I speak to the point that you made about what are the legislation what are the protection mechanisms. And then again, I mean, women and girls tend to be a little more vulnerable to this information. For example, I take the US, we are in America here, I take the US as an example, the overriding of the abortion access, you know, was a huge problem. You know, apps that tracked periods. It wasn't safe to use those apps because then it could be a signal to go and you know, the women who are accessing abortion services, they will be tracked through those apps. So how safe is the environment? You know, how strong are the legislation are to protect girls and women from unnecessary harm, where you have punitive, where you don't have legislations to protect their rights and access to services. So I think that becomes very important, that balance we need to establish, you know, where to draw the line and what not. So, you know, both in terms of access, one of my co-panelists talked about what young people want in the survey that PMNCH led. 3,000 young women have asked for cell phone, access to cell phone, as something that is essential for their well-being. Now, we tend to think of technology as being far removed from well-being, but it actually is not. It allows connectedness, it allows access to services. So from that point of view, I think it's even more important that these become connected.
Yeah.
I could go on and on about access, but in the interest of time.
I actually want to drill down on that because PMNCH is focused on the health and well-being of girls, women, adolescents, and we're talking about strengthening health data governance, particularly from a legislation point of view. Can you tell us more about why that is important?
On the rights part of it, very, very important, both from the rights part of it and the protection part of it. One is legislation, and I see so many partner governments in the room. You know, it's very important that legislations underpin access, and access is of course driven by rights. You know, when young people and women have rights, and I have a young daughter. She's studying law, And she always comes back to me and starts to talk about first generation rights and second generation rights. So I've been able to understand from young people, and like all of you on the panel, she says that, we treat digital access as a second generation right, but it is not. It's a first generation right. And people like you, people in the room, I'm not a digital native, but all of you who advocate for digital access, we have to take that cause of making digital access as a first generation right, not a second generation one. And once that right is established, you have access, governments are and office bearers are held to account on making those rights available. And how do you make those rights available? Through legislative instruments. So that's one part. The second part, and I think which is even more important in the current climate of anti-rights and pushback against SRHR, is protection. How do we protect women and girls from being stigmatized, from being persecuted, from being penalized because of what they need for the bodily autonomy? So a balance has to be there, and we have to promote and we have to speak to partner governments to ensure that the right legislations are put into place to protect women and girls and protect their data and protect their privacy. And my colleague here, and she's spoken brilliantly about data protection and access to services and funds.
So for you, Shannon, Anshu has spoken about health and well-being of women, of adolescents, of young people. But for Health, the focus is very much on digital health and the work that you have been doing around data governance. What are some of the engagements you have heard? What are some of the concerns that you hear? And what are the recommendations that you have had from the young people that you're working with?
Yeah, I think I've spoken. Yeah, okay, there we go. Nice to have a mic that's not just a prop mic. I think I've spoken to a few of these things in my last answer. Again, we do see as Yet for Age a lot of energy among young people for this issue, but also I think some trepidation to get involved because young people don't always feel like they have the technical expertise, whether their experiences in healthcare, or a broader kind of global health development topic. They don't always have that specific training in digital health or health data governance. So we really do hear from young people that they both need youth-focused supports, training, capacity building to give them that confidence to enter into these spaces. Sometimes having the door held open to actually let them into these spaces, to have access to decision makers. As well as, these spaces to become more inclusive over time and more accessible to young people. So those are a few of the things that we're always working towards as Yet for Age. But again, we are a very small group. It's important to us to broaden this group and to make sure that there are more young people who are able to come into these spaces and have their voices heard.
Let me jump to you, Roderick, because Shannon raised a great point around specific training. And for communities, they don't have specific training in data governance, but your campaign that you ran, My Data Our Health campaign, it brought new knowledge to these communities about the importance of data. And part of the things that you did was share some of your achievements and some of your learnings. And I wonder, has there been any response from some of the regional bodies like the East Africa Legislative Assembly based on some of the work that you have done at the community?
Yes, of course I know dealing with the policymakers, especially regional level, these are quite bureaucratic organizations, and also working with multiple countries, as we know, especially the East African community. Not all countries are at the same level. Countries are different level. When you look at the policies under the governance, some of them have strong policies, others have very policies. And as we work together, looking around harmonization of these policies. And one of the achievements for us has been we were given a space to be part of the East Africa Community Heritage Working Group, bringing all the bring all the countries from the Ministry of Health and the Parliament so that you can sit down and discuss some of the health issues. And policy, given that the difference in countries and policies, so that become easier, but by providing that space so that you can discuss and for us what is a critical that we have achieved. And I think another thing is we understand that we do have individual countries, they have the parliament and also the Ministry of Health. And when you come at the regional level, sometimes there are differences in terms of enacting a law or concept at the regional level. It means all the countries need to accept it. If one country is not happy with that, then it means that one cannot go through. So there have been quite of going forth and back and forth, but I think as we've grown, I think it has been quite very impressive. And of course, of recently, I think in the next 3 weeks, we're expecting to meet with the parliamentarians at regional level to discuss around the key health issues. Of course, find that when you meet them, you don't have to talk around one thing, just how to integrate. But of course, that's one of our topics that we discuss with the parliamentarians. Of course, another challenge to us has been the frequent changes to the leadership. This will come and go. Even the EAC secretariat itself, the director, the secretary general, they have been having frequent changes. So you find that when they come back, you have to go back again and start talking the same thing. So, and it requires a lot of resources. As advocates, we don't get tired, we keep on pushing.
It sounds like you have taken a few steps forward, and I will ask then Petrida, because you've given us the example from a regional government perspective, and you mentioned that you had a health data governance manifesto that you are putting forward to the parliament in Tanzania. How is that going?
Well, actually, so when we talk about the governance manifesto, it's more of a collaborative manifesto where we got different endorsements from different CSOs and presenting it to the government through the members of parliament, because as you know, I can just walk in parliament to present something. CSOs, we do contribute well to the work that we're doing, but we have a limited limit of where we can reach. And that's where we count on our ministers, our senior leaders in government, and I think we have some who are already over here, to actually be able to push the agenda forward. Because at the end of the day, we don't want to seem as if we are going against the government at some point or challenging the government, but we are actually challenging the government in a better way that we also want to improve in our communities and in our societies for a better health outcome. So ideally, the deliberations are still ongoing, and we still hope to get a better outcome at the end of the day, because it's a long process. There's a lot of parliamentarian sittings, but actually once we have any senior leaders, especially with the target of the Minister of Health, to actually move the agenda forward, it actually helps. But most of all is the fact that I think what we have achieved is open the dialogue on health data governance. We lack a lot of capacity building. I think Shannon did mention it, especially in our communities, to understand what is health data governance itself. So I think that is something that we are actually also working to ensure that we contextualize it and understand it first. Before we actually just go ahead with the agenda. Let's move to the digital health agenda, because sometimes it can be seen as Western, but it's really not Western, but it's just a system that actually improves the way of life and access to information as the way the digital world is going right now. That's all.
So I think, this has been an excellent panel. We have heard about data governance from a personal issue. We have seen it's a community issue, but it's also a rights issue. So as we close, I have one question for each of you, the same question. What are your expectations of your government and other key actors when it comes to strengthening the governance of your data and for all our data? What is your expectation? Let's start from Audrey.
For me, the expectations are around having enabling development for us to be able to access our data and be able to hold them accountable on how it is used for our own benefits.
So basically from my side, my expectations is to have actually our country be part of the pace of the digital world and not be seen as a platform or an opportunity that is for the certain communities, because we do have that gap whereby there's certain communities that can have access and not have access. So just to have that equity amongst all of us when it comes to health data governance access.
I think it's really important to remember that today's young people are going to be users of their health systems for many, many years to come, right? About half of the world's population right now is made up of young people, but our voices are often excluded from decision-making spaces, which can and has resulted in policies and systems that don't meet our needs and don't sort of, recognize our priorities. So my ask for governments and decision makers would be to look around the table and ask whether young people's voices are being represented before making decisions. And importantly, to also recognize that they need to be ready to make changes in response to young people's input if they're asking for that input. And that's how we'll be able to move beyond engagement that is tokenistic to engagement that's actually meaningful and transformational.
Thank you very much. I think after all that has been said, there is only one thing for me to do, and that is to channel the voice of my young colleagues. And as an organization that is pledged to serve member states, my asks are threefold. One is accountability, and thank you, Roderick, for introducing that word into this room. And I think it is one way to make sure that you hold office bearers and duty bearers to account. I will use India as an example. Please bear with me 30 seconds more on this. As Government of India launched something called the COVID and during COVID, which tracked immunization and COVID immunization as well as COVID vaccination across population groups. So it was a mechanism from the government point of view, it was a mechanism to hold themselves to account. So it's a very, very important aspect. My colleagues also spoke about equity. So to use access to data and access to digital health interventions as a means of ensuring equity, especially for population groups that are marginalized, vulnerable, and not in the mainstream health service delivery system. Last but not the least, as PMNCH, we work very much on meaningful adolescent and youth engagement. So voices of young people are not a monolith. They're not homogeneous, so we need to be taking that into account. So thank you, all of you, for giving me ammunition to make requests to member states that these are the three things that collectively we ask our own. So thank you very much.
Thank you. I don't know if we have 5 minutes for questions from the floor, but before we get any questions, I see Olivia in the audience. Olivia, do you have anything that you would like to contribute to this conversation? I know you do a lot of work here.
Sure. So I think, hi, I'm Olivia Bless. I'm the Director of Technical Services at CAP. We're one of the partners responsible for that. And I think one of the trends we saw across all the speakers today is what we really want when we talk about, we talk a lot about digital inclusion, but digital inclusion also has to include data inclusion. So are we collecting the data that represents everyone? Is it representing women and girls? Is it representing youth? And are we able to make decisions about how we do healthcare planning within the government level, at the community level? We can't if we don't have inclusive data sets, right? And inclusive participation in the community to contribute to how that data is being collected and what's being included. I think also we want to think about privacy and security, because for so long it's been an oversight, or it's been secondary, or it hasn't been comprehensive. And so we want to protect patients' data. We want to protect their privacy. We want to make sure people understand when I'm giving my biometric data, like I'm giving up part of my personal bodily autonomy, right? And we don't always explain that to patients because we don't have a lot of base level digital literacy and health literacy that's happening. So all of those foundational building blocks need to be included as part of that process. So I really think this model law is really going to contribute to broad understanding of what does it really mean to be inclusive when we talk about health data governance. So kudos to everybody on the panel today for their contributions.
Yeah. Do we have any questions from the audience? Because we have a minute. I can close it. I can close the panel. And just to summarize the key things that we heard from civil society around what they want from government. Few words: access to their data, accountability. They want governments to be pace setters. So they want no one left behind, and they want equity. Young people will live with the decisions we make today. They need to be involved in making those decisions. We want governments to include, to listen, and to act. Thank you.
Thank you so much, Caroline, for brilliantly moderating this really very insightful, fantastic panel. And before we turn to the next panel and then have a short video, I wanted to recognize a special guest because several of the panelists talked about the importance of parliamentarians in this work. In the end, this has to be translated into national law. And therefore, I'm particularly pleased to have here Guillermo Duarte, who is the executive director of UNITE, the global network of parliamentarians engaged in global health. And Guillermo, I believe you have members from more than 100 countries. Is that right?
Yes, we have members from over 112 countries right now. We have over 500 parliamentarians that we engage them in promoting global change for health and of course for legislation on this. We also have a policy desk on digital health, so it's quite timely, and we are proud also to collaborate with some of the organizations, including Transform Health. So we're quite interested to be able to take it back to our parliamentarians, promote their capacity, and also with your help and your participation to make some change directly into the legislation. Also parliaments, and also to promote a bit of accountability and from the government to be able to engage with citizens directly. Of course, I need to remind that parliamentarians are usually directly elected by people, and of course, they are responsive to people. But thank you so much.
Thanks a lot, Yami. I thought this was important because indeed I trust that the members of your network will play a very particular role in implementing what we are discussing and recommending here today. And I trust this is also an offer, of the partnership between Transform Health and the Unite Network. I think that is a very important aspect. So thanks for being here. And with that, I understand we have a short video on health data governance before we turn to the second panel. Thank you.
Our health data contains the most personal and sensitive information about us. It also contains information that is critical for researchers and health planners. Therefore, we must protect our health data while ensuring that it can be used for public benefit. But can we trust that our data will be used well, used wisely, and used safely and responsibly? Transform Health is calling on governments to establish clear rules around the way health data is collected, managed, used, stored, and disposed of. We need a common set of standards on health data governance to ensure people are equally protected everywhere, and that health planners and researchers are able to use health data for public benefit purposes. This will also make it easier for governments and others to share information across borders as we travel and move countries and need access to our data, or in health emergencies for countries to share and compare vital information to make informed decisions. Transform Health is calling on governments to support a global framework and champion the model law on health data governance as a basis of a global framework for adoption into national law and endorsement by governments through the World Health Assembly and relevant regional mechanisms. In January 2023, a number of organizations concerned by these issues joined Transform Health's My Data, Our Health campaign to raise awareness of the importance of health data and to call on politicians to ensure clear laws and regulations are in place to protect it, while also enabling others to use it for collective good. Over the last year, they've been engaging the media on this issue. Even parliamentarians are increasingly recognizing the importance of effective legislation and regulation on health data.
You go to Kolebu, Kolebu has its own data. We go to other health institutions, 37 military hospitals, they have their own health data. And so when it comes to making national policies, we'll have to find another way of retrieving information from all over to be able to get a central position in for decision making. And so I feel that the subject on health data governance is very important.
People were also invited to take part in the Where's My Data campaign action and to visit their health centers to request access to their data. Over 50% of participants were denied their data. Here are some of the reasons that were given.
My health record is erased due to some technical problems.
He told me to come with a written document or I go to court. Didn't know it was going to be this hard. I thought it was my right, but that's not the case.
In the hospital, there were too many referrals and later denied me my health data records since I might sue them and later on they demanded for a document from Ministry of Health.
Of those who received their health data, over 33% said that the health providers were initially unsure how to respond to the request or asked people to return at a later date. 13.5% of respondents were asked to pay a fee to access their own data. And over 45% of people who received their health data found it to be incomplete. This is impacting trust in the health system. Nearly 50% of respondents were concerned about how well protected the health data is as a result of their experience. People are starting to reconsider the importance of their health data and realizing that we need to pay far more attention to who has it and how it is being used.
Well, for me, in the age of AI, I'm beginning to see that data is as important as safeguarding persons. It's as important as safeguarding a physical being because your data is you.
Good health data governance matters. We encourage you to join the campaign and take part in the Where's My Data action. Make sure we have stronger governance and regulation of our personal health data.
Thank you for that very instructive video. And now it's my pleasure to turn to the second panel on policy leadership, very important for what we are discussing here. And my particular pleasure to introduce my dear colleague, Nana Makama. Nana has been a globally recognized advocate, I would say, for equitable and inclusive digital transformation. She serves as an advisor to Transform Health, and she is also a fellow board member of Health AI, the Global Agency for Responsible AI and Health. So we are particularly pleased to have you here to moderate the second panel. Nana, welcome. Over to you.
Bonjour et bonsoir. Good evening. Hola. Thank you for having us. I have high-level individuals here. Everyone has a doctorate degree to their name. I'm going to begin with Her Excellency, Madam Minister Dr. Amina Kasabani. Bienvenue, Madam. Dr. Ali from Somalia. Dr. Amina is from Burkina Faso. And I have my other panelists right behind, Turanira, Dr. Turanira from Kenya. Dr. Duraniran from the Health Desk of the Presidency. Dr. Abdul Ali is from Somalia, Health and Human. Yes. And the Minister. I will be speaking gently. I may have two of my panelists online, one lady, one gentleman. I'm trying to check if they're online. Please let me know when they get online. That will be Cote d'Ivoire and Uganda. Please let me know when they are online. So I've been taking notes of everything that the civil society has said. That was a whole lot. I will start with Burkina Faso, then I will come to Kenya and Somalia. First, we would like to know the challenges. We've heard some, but from the government side, digital health is the junction between digital and health. I know you as a data expert. I know you as a researcher, and then become a minister. So I got you here. But I know you don't have all the solutions. It is good that we have the parliamentarians here. What are the challenges for a country like Burkina Faso to be able to respond to all the expectations of the civil society? Vous pouvez parler en français, je vais essayer de résumer en anglais. Il s'agit de nous instruire sur les défis que nous voyons du côté du gouvernement, un gouvernement, forcément celui du Burkina Faso, tenant compte de votre expertise dans les données, dans la technologie, la digitalisation et la gouvernance. Bienvenue, Excellence.
Merci. Merci. My English is not fluent enough, so I will speak in French, and then I will help me for the translation. Donc, merci. Je suis ravie vraiment de prendre part à ce panel. Comme l'a dit, je suis ministre en charge de la transition digitale, donc je suis un peu de l'autre côté. J'essaie d'apporter notre expertise technique à tous les secteurs pour qu'ils puissent profiter du potentiel du numérique. Oui, d'accord. Donc, ces échanges m'ont permis d'avoir aussi une autre perspective. Je pense que les jeunes ont parlé de leurs attentes. Elles sont nombreuses et elles sont pertinentes également. Donc, aider les autres secteurs à profiter du digital, c'est non seulement pour le gouvernement lui-même, mais aussi pour les populations. Voilà. Aujourd'hui, avec le digital, pas mal de services sont accessibles en ligne et ça facilite la vie aux populations.
She's from the digital sector, and listening to the civil society has been rewarding for her. Her duty from the digitalization sector is to ensure that more services and are updated online, and all of the society benefits from it, including, of course, the health sector.
Voilà. Donc, une fois qu'on arrive à dématérialiser, on a accès aux données, et je pense que le numérique a pu montrer la puissance des données pour informer, pour aider à prendre des décisions éclairées. Et cela est vrai dans le domaine de la santé. C'est vrai qu'on parle de la gouvernance des données, mais avant, il faut déjà collecter ces données-là. Et aujourd'hui, le numérique nous permet de collecter plus facilement ces données, les rendre accessibles, les analyser plus facilement et ensuite pouvoir en tirer des connaissances qui permettent au gouvernement de prendre les meilleures décisions, d'anticiper sur certaines tendances, notamment dans le domaine de la santé, des débuts d'épidémie et tout ça, et de pouvoir en tout cas élaborer de meilleurs projets qui sont, on va dire, en adéquation avec la réalité.
So digitalization it's for everyone because it allows to collect the data. It allows to make it accessible, including health data. It allows for decisions to be made. It allows for the government to foresee stuff like epidemics and react accordingly, and it allows for better governance.
Et pour les populations, on l'a dit, ça leur permet d'avoir des services de qualité, d'avoir dans le cadre de la santé la mise en place de la télémédecine. Nous avons peu de spécialistes, notamment en Afrique. Donc, avec ces mécanismes, ces spécialistes, même s'ils sont dans les grandes villes, ils peuvent assister les infirmiers, les médecins dans les zones rurales pour améliorer la qualité des services de santé.
So services like telemedicine support populations with limited number of doctors, as has been raised, and wherever they are, they can always bring in their expertise remotely. And that is why digitalization comes into this.
On parlait des avantages, mais ça vient aussi avec beaucoup de risques, beaucoup d'appréhension. Avant, les données étaient disséminées dans des registres. Ils étaient difficiles à exploiter, mais on pouvait aussi moins facilement y accéder. Mais aujourd'hui, on les centralise, on rend l'accès facile à des personnes aussi mal intentionnées. Donc, on comprend l'appréhension des populations par rapport à leurs données. Et donc, il est important de pouvoir les rassurer, de mettre en place les mécanismes qui vont permettre de protéger ces données. Les données de santé sont des données personnelles assez particulières, très sensibles. Donc, sur ces données en particulier, des efforts doivent être faits. Maintenant, pour revenir.
The fear of data misuse is valid because before we had them in paper and it was difficult to access. But now the flip side of digitalization is that data is centralized and it can be centralized in the hands of people with ill intentions. And that is why one of the challenges is a challenge of governing who accesses the data so that everyone can be sure, can be secure.
Pour revenir rapidement au défi, je comprends plus de temps avec la traduction. Je pense, Paul en a parlé, en a parlé. Dans nos pays, c'est déjà le niveau de la digitalisation et des infrastructures déjà.
So the level of infrastructure is one challenge.
Donc aujourd'hui, on a besoin pour pouvoir collecter des données de façon complète et fiable et pour qu'elles puissent être, on va dire, utiles. On a besoin de connecter tous les centres de santé, de pouvoir digitaliser tous les services et collecter de façon efficace les données.
So for us to move forward, we actually need every health center to be connected because for interoperability to be there, we need everyone online and we need everyone to interconnect and be interoperable. But that in itself is a challenge because of the low level of infrastructure that we have.
Deuxièmement, pour ce que nous avons qui est déjà en place, nous avons, on va dire, plusieurs modules, plusieurs outils numériques qui ne se parlent pas. Donc, on a un gros problème d'interopérabilité et on perd toute la puissance des données.
We have different platforms for health management. We have diverse platforms and tools for management, and they're not speaking to each other. And that makes it even more expensive to hop from one platform to another because there is no interoperability. That's a challenge.
Deuxièmement, on en a parlé, on a un cadre juridique qui n'est pas assez robuste pour vraiment protéger ou en tout cas nous permettre d'avoir une gouvernance des données efficace ou à la hauteur de nos attentes. On a par exemple au Burkina Faso et comme dans plusieurs pays en Afrique, on a la commission de l'informatique et des libertés. Donc, on a généralement des lois pour la protection des données, mais de façon générale, pas de façon spécifique sur la santé. Donc, il y a des éléments qui ne sont pas pris en compte. Donc, cette loi, elle seule ne suffit pas pour nous permettre de pouvoir protéger, en tout cas, les données de la santé.
Merci. On va passer le micro au monsieur du Kenya. She says the legal framework is not there. Burkina is in the same, in the basket of countries who have a general data protection law, but not a specific health data law or act. Dr. Turania, Kenya is a bit more forward than where Burkina is. You have an act already. So let's hear about the Kenya Act.
Thank you. Good evening and greetings from Kenya. We love you. So Kenya's journey has been long and winding. And if we look through where we are now, we had the Kenyan Constitution 2010 with small mention about health data. Then we have the Health Act. Later on in 2019, we got what we call the Data Protection Act. But now when this government came into office, where I work, we decided we want to reform the delivery of healthcare systems. Our president has been in the political field for quite a long time. We have had 4 attempts in delivering universal health coverage. He has been in that journey as an opposition leader, as a minister in other ministries, as a deputy president, and he has learned the mistakes that we have done all along. So it reached a point where he decided that he has 5 key pillars that he has to deliver, and one of them is health. The other one is creative economy, agriculture, affordable housing, and just the normal issues of cost of living and such. And he's very big at digitization. Can talk about the other sectors, but let me limit myself to healthcare. And once all this started, we came up with a framework for delivering universal health coverage. And we, of the 7 pillars that the WHO emphasizes on for delivering universal health coverage, we focused mainly on 4: human resources for health, health financing, commodity security, and what we call a health management information system. Later on, coined to be digital superhighway. The names have changed a lot. And what did you envision? My background, again, is not in any way in digital health. I am a pathologist by profession with a lot of interest. So soon I'll be joining the class. Very good. But how do you succeed in this? I know what we need to do, but I'm not the expert in it. So we bring all the experts into one room. And it took us a long time to bring all the health experts in the country to get a common position that we need to move this way. We had a workshop with all of them in Nairobi for like a week. And we told them this government was to digitize health data, this government was to digitize health facilities, this government was to protect your health data. Just a long story, and you listen to people. All I know is that I have some little mark in influencing the political decision, but they have to do the work. So after we sit down and agree, we go back to the boss and tell him, and we have nothing that governs health data. So we need to legislate. Why are we legislating? We should legislate because you might not be there. We have political goodwill with you, but you might not be in office for long. After your 1 term, 2 terms, we need a governance structure for that. So he whips his members of parliament, number 1, to pass 4 health laws. Kenya should clap for Kenya. We have 4. 1 governing social health insurance, 1 governing primary health care service delivery, a 3rd one governing the ring-fencing of finances for healthcare, called the Facility Improvement Financing Act, and a Digital Health Act of 2023. Wow. Okay, so we get 4. They go through National Assembly, they go through Senate. Kenya is a very political country. I'm sure you know that. We always in the news. And this digital era makes us be in the news all the time. So the laws are passed. We have an act enacted by the president on 19th October 2023. Will be a year old next month. So first and first. Then we decide if we see that goodwill, so you have to rush to start making it operational. You appoint a board. We have a board. You appoint an acting chief executive officer. We have an acting chief executive officer. We are just about to finalize the human resources instruments to get our own. This one forms a government, what we call parastatal or semi-autonomous government agency whole government agency called Digital Health Agency to run that business.
Okay.
They're independent, they're out of it. So challenges, literacy levels. Let's not lie to you. We are actually in the news because of a lot of things going on. Currently, about that digitalization, you go through Kenyan information. There is that politics. Number two, we have over 700 systems that never spoke to each other. But also we had systems that were running, that were benefiting a few, and they are fighting back. Because now we sat down and they said we cannot agree. So who's the best in technology in our country? So far, leading communications company, Safaricom, has been leading. So government got into a partnership with Safaricom and handed over that business to Safaricom. Has been doing a life-changing money transfer thing that is topic of discussion everywhere. Safaricom can never agree to fail. They can never fail. It's against their brand failing. So we told them, you can do for us and digitization. Yes, yes. Now at their back, they engage many other partners. So some political and everything. So there's a poor understanding of the digital health space. People don't understand what you're trying to do. We have a very successful program called the Electronic Community Health Information System. Part of the team has been working on it. And each is what community health promoters do. Long time they used to walk around with big books. And we decided to buy them smartphones. 107,800 community health promoters have a smartphone like this one, with an application in, with data that is being paid for government. So they walk into a household, they do the basic test, they input all the details in a system. It is transferred to a data center. Their literacy levels also, we have to take a lot of time training them.
Let's take one more challenge and come to Dr.
Thank you.
Dr. Lin, we've applauded you because you're a champion. And that's why we're coming to you. We have a country that has a general data law. We have one that has a health data law. Where is Somalia? And what can you advise us in looking at the health data principles? We have 8 of them that kind of takes into consideration what the civil society has done. But I'm also looking at the regional level because we're looking for leadership at the regional level. How do you think from your professional point of view? Because you are the core health person in this panel. I'm from the internet. She's from the digital world. He says he's a pathologist, yeah? And so you are the main man here. That's why we're coming to you last. How do you guide us and other countries across the world into stepping into health data law legislation?
Thank you. Good evening, all of you. I think
is that one working?
Yeah. I think from the perspective of the challenges,
yes,
that you share, speaking of us, I think it is quite step forward with Kenfas and Somalia. In Somalia, the challenges of the health digital is quite when we look at we have been shifting from paper basic recording and reporting to digital. So in the beginning, the challenge was when we were in that paper basic recording, we might have the challenge to miss some of the data or compromise or lost the data also. But when we transition to the digital, we can have challenges is succeeded to pass over. And the other challenge we have faced was the fragmentation of digital health systems. The country has health information management system and the platform we use for the DHSI tool. Many partners are deploying partner systems. which quite poses significant challenge to the interoperability and the integration of the data in the country. Again, when it comes to collecting data, the responsibility to protect and secure data rises, then data protection is quite not that level that it was ought to be. So there is a weakness in that area because the regulations and specific policies regarding the health protection of health data is still missing. Again, the country is reviving and coming back on its feet. So it is in the state building and the state governance building and institutions and capacity era. So there is no technological infrastructure that's advancing or similar to, for example, the neighboring country like Kenya, where maybe the country has national data storage center, that the country has advanced institutions that has the capacity to store and secure data. So also that we just share some of the countries like Kenya and again the issues of the cyber security threats and privacy concerns due to the low data digital literacy or health data information awareness. You might see that some of the health data is compromised, specifically for cases like people with stigmatized cases. Their data is breached and compromised, and that causes a significant challenge for them to run away with health service in the areas used digital data because of the compromise they have been experiencing. So again, it's the privacy of their data and the consent they have is not protected well. So, and ultimately is the financing of digital health solutions. As we are, when in Somalia, the internet is quite, the internet availability is well. The digital age is quite high. We don't have the challenge like many countries have. For example, the 75% of the population is the young age, below 25. So the digital age is quite helping us. We don't have a certain group of people who are quite more challenging on the digital. We have, but it's not significant portion of the population. But investing or financing such health solutions, while it's not the government or our partners are not doing well than so here, apart from this challenge, going forward, as a government, when you look at we have started first to have the regulations. Just last year, the country established its first Pet Protection Act. It's passed through the Cabinet Council and all the way to the, and it has been established first time Data Protection Agency, which is independent authority that's dedicated to protect the data. So it is even 1 year anniversary is not it's not celebrated yet that I just said. But due to the significance and to protect the population's data, the process of establishment and operationalization is underway. Okay. Again, here is missing regulations and policies that are particularly to the health. And now here we are where we can. The Minister of Health now is working on to have replaced health protection regulations.
Thank you very much. Can I have my mic back? Okay, so we're halfway down this panel. We're going to take questions. Yes, we will take questions. However, we need to come to the initial presentations that were made to us. So there has been a drive for a health data governance model law. This proposes 8 principles that take into consideration the protection of privacy, the protection of people, the promotion of value, and equity. I've looked at the model law myself and its principles. They follow the same principles that the Global Digital Compact and the pacts that we've adopted for the future. It's followed that same principle. And I believe that makes life easier for us. Going forward, that's where we are now. Will this be something that the government can use, and how can it use it? Because I'm looking at the summit in Addis Ababa, and we'll be looking at pulling all our experiences together. Experiences from countries that have digital data protection, but not health data protection. Experiences from countries that have just started data protection, and experiences from countries that already have data protection and health data protection. How do we harmonize this as African, and how do we take it? So this is not an African initiative, but when we move as Africa, that helps us internally, that also helps the global or World Health Assembly. I hope Dr. Munene is still here. Yes. What message are we giving to our leaders at the Africa level and the World Health leaders at the global level? I'm going to go around, and then we're going to come to our friends if they have questions, and we want to wrap it up after that. I'm going to begin from you, and I'll end with the lady. Yes, that way.
I think the good news is the adoption of global digital compact.
Yes.
On the future summit yesterday. It was a huge step. And I really brought the United Nations and General Assembly the concrete step they have taken forward for our activities compact. For us, as a government, we've already started. We should have started implementing putting in place the operationalization and implementation of these compact at the country level, where integrated to that compact into the national level with priorities and the strategies and the laws and policies. But as a government, also we have responsibility to advocate at the regional or continental level on the coming events like the AU summit. We should advocate for the data governance and the investment of reconciliations in the health sector. We should prioritize and advocate more on how the countries and government integrate their data governance and the frameworks they have. Such kind of responsibility as a government, we can also advocate on how at the regional level we can put in place an integration framework where that exchange policies can be enacted. Because at the end, there should be a data governance framework between the governments and at regional level, at continental level, at global level. So based on the digital compact and all the way the recommendations on the compact, I think we have a space or room to act as a government as regional leads as on the digital health.
Thank you. Dr. Kiranira. I want to know if there is someone online. If my speakers are online, please let me know.
Yeah.
Okay, cool.
So from our experience, we are here to share our experience, tell the world what we have gone through. It's been rough. It's not easy.
Are you scaring us?
No, it's good I tell you so that when you walk in, you know you're walking into a space of people who have a lot of resistance. The clique that understands digital health and its importance is very small. They're in that corner. The rest of us will want to think, you want to do it to use that data for other people. So there's a lot of education you need to do. There's a lot of patience in that journey. But more importantly, after that, we need to be advocates. We are maybe I would say a step ahead of the rest of it. So just one. So there's a lot we need to sort out. So we need to join in the advocating and also shall be there to mentor others with experience. I think the most important thing we need to do is that, these platforms we attend, platform in Addis will be hosting most of you in December in Kenya. I think a call to action is to be there. One of the things that we really need to shout and scream about is that a call to action to all governments to work in the same direction. And whichever platform we find at the UN, whichever platform we find at the African Union, whichever platform we find in the world, scream about it. Let it be. It's stylish to have a digital health legislations. It's stylish to move that through. So it's good. We are ready and we are available. We have a full team. When we come in December, we'll be displaying how we are digitizing our 15,000 healthcare facilities in the country.
Wow.
For you to access social health insurance in our country as a provider, you must be digitized. It's a precondition. We will onboard people. There's just a small lag period for doing paperwork.
Okay.
But after that,
please give us the dates for December.
it's for. So we have the Global Health Digital Health Forum in December.
Global Health Digital Forum.
Global Digital Health.
Okay.
This is the co-chair.
Oh, it's the co-chair. So they changed the name.
Just hold on. While we are here, Madam Chair, can you please
invite us?
We will invite ourselves. Africans will invite us. We don't need visa to Kenya.
Yes.
You just fill the form online, we arrive.
Yes.
For everyone, please, can we ask you to inscribe in your agenda the health digital governance that we have, the model law that we have, and then we are trusting you to champion it for us.
Yes.
We already have 2 male champions, 1 female champion. Me, I can talk and tweet, but yeah. And we also, can we, Dr. Munene, are you here with us?
Yes.
Can you please help us ask the World Health Assembly to put this on your agenda in May? Would that be possible?
Working closely with Christoph Ben, we can turn the mechanism.
Okay. I know how to track people online. I don't know health, but I know digital.
Yes.
Yes. Okay. Let's come to Madam. From the digital side, how do we move forward from this? We already have a data protection. We have a model law that is there. How can we marry both of them quickly and move forward?
Thank you. Déjà, au niveau du Burkina Faso, à cause de la dynamique d'accélérer la dématérialisation, nous travaillons étroitement avec le ministère de la Santé et ils ont déjà fait un état des lieux.
Okay, there's been a review already done within the health system.
Yes. Donc, déjà au niveau technique, pour essayer d'avoir une meilleure architecture, on aura un système harmonisé où on aura l'interopérabilité. Et maintenant, au niveau de la législation, il y a un travail qui a été fait avec l'aide de partenaires techniques.
So a technical review has been done, and on the legislative side, work is ongoing.
Pour identifier les écarts entre ce qu'on souhaite en termes de législation pour la donnée de la santé et ce que nous avons actuellement.
So they are doing the gap mapping between what would they have and what will happen.
Voilà, donc ce travail a déjà été fait. Et ce qui est en cours actuellement, c'est d'ajouter des sections qui prennent en charge la protection des données de la santé au niveau du code de la santé.
Okay.
Voilà, donc là, on est en train d'ajouter ces sections. On va passer au niveau de l'Assemblée d'ici, j'espère, la fin de l'année ou en 2025. Et après, on pourra prendre les décrets pour pouvoir implémenter ces sections-là et mieux encadrer la gouvernance des données de la santé.
Okay, so review has been done within the technical sector. Review has been done within the health sector. Now the gaps have been mapped, and the next stage is to have this, both of them shake hands in front of the legislator, and between now and next year, we hope that something is going to come out. Did I capture it right?
Yes, on the legislation part, we want to add some sections in
the health law.
Yes.
Existing health law.
Yes, exactly. Which is in review.
Anglais sorti. Now we have to applaud you for speaking English.
Bon, j'essaie de continuer. So after that, we will take now some text to better govern health data based on this law. So we are in this stage. But I think the model will help because the model is like, how to say, from many experiences, so it can help to move
the national legislation.
Yes, exactly. Forward and maybe quickly.
Okay. Merci beaucoup. Il a champion for today. Ça va le vous rentrer, vous dites aux gens que Madame la ministre pose en anglais ici à New York. Yeah. That report should be there. That she did this panel in French and ended it in English. Can you do it in Swahili? Anyway, thank you so very much, Excellencies. We are grateful for who you are and for the work you do. Does anybody have a very important question? So it's December 4th to...
My question is to the president to invite us.
Madam President, we have a question from my panel. Let's ask both questions. So the one of the invitation today was by Transform Health. Yes. And the chair of Transform Health, so Crystal, are you inviting myself and the panelists and the team? Are you inviting us to work on the regional harmonization of our health data governance laws in Africa? Would you please invite us? Should I go on my knees?
No, don't do that. Granted, never.
All right. On a notre invitation pour le Kenya pour parler de l'harmonisation de loi. Okay. Sur les... Yes, sir.
I'll just speak aloud. Hey, everybody. So I want to just thank you all. My question is to Dr. Thuranira. You spoke about the amazing legislation activities going on in Kenya, the requirement expectation, 15,000 health facilities are digitalized. However, we're all aware how many people are not able to easily get to an access of facilities. The government also expecting these same vision for the community level? Didn't know if you might share a little about that.
So thank you very much for that question. We have people who cannot access hospitals because of location and distance. Hence, our introduction of the community health promoters program that delivers basic care at the home. So that's level 1, community level. But with their basic knowledge, and they have a smartphone, they have an application called the Electronic Community Health Information System. For the ones that is simple can be sorted out the home, but the data is put in your client profile or portal. Now, the one requiring referral will be the ECHIS will be integrated to the health management information system at the level 2, level 3 going up. So based on the referral to be done, the patient will be referred. But more importantly, these community health promoters are attached to a contact facility. So they will not only follow you up, they will make sure you went. They will document you went. They will even come back home and visit you and say, did you go? Understand? So then we sorted out the base. And the base is, let us assume no one accesses healthcare in a facility. That's an assumption. So let's take care of those ones. So we get a community health promoter with a bank that has a blood pressure machine, basic things. Weight, has a glucometer, has basic medication, something antibiotics, something for fever, basic dewormer, basic, quick dressing, bandages. You are bleeding, let's cover that, I should be hospital. Basic education. Now they can fix that, but there's no paperwork anymore. It has to be put here. So if that person, we envision that once we digitize this other thing, that information that was collected in the facility, at home, shall be found in the system. And if you move from one facility to another, our president is a champion of what we call data portability. He will talk, then the first thing he says, data portability. I need to go to a facility there, and when I come here, I find it. The reason being, small experiences of, I've been a doctor, worked in many facilities, and you ask this lady, are you on anti-hypertensive? Yes. What kind of medicine do you take? They describe its color. So they say the small red tablet that can range from being the Felipe to anything else. Understand? So she'll be coming. She tells me the small red tablet, I know the name. So it's a long journey, but we'll get there. And I'm very positive that one day it's other countries that you will come and pass us. So take heart, it can be done. It can be done, but it needs all your might, all your strength, all the sacrifice, and don't lose focus.
And some financing.
And some financing. Thank you.
Do we have any other questions? Let me come to you, Madam. We have one last word each, but we're talking about low level of access and low level of infrastructure. Someone here mentioned women. That's why I'm coming back to you. Is there a way of using low level technology to make it just easier for women in Africa or women in Burkina Faso? Because he's saying have someone have a basic kit. Does this solve the problem of women?
I think it can help because we have received strategy in Burkina Faso where we call them agents communautaires.
Community health agents.
Yes. So they are in the village, they are member of the community, they train them, they are the kids, and they are also a cell phone with platform. So they can go from home to home to see there is a problem, how they can help, and how they can guide people to add the medicine. I think this can help women because they are near to them, and in this agent, community agent, we can have also women that know them, that can talk with them. They trust her, so they can easily talk
about the problems and have help. I think this proximity between women to women and community members to other members can help also to access easily the help and explain what really happened to them.
That's my own takeaway. In the community health agents, we just don't need technical interoperability. We also need the human interoperability.
Yes.
We need women to be the face of the health that women would see. Bring back the mic to her. We are wrapping up now.
Yes.
One last word. What do you want us to remember? And we'll end with him because he's from the president's office. Okay. Yes, sir.
I think the health experiences and the challenges are similar.
Yes.
Same context. For the issue of low coverage or low access.
Yes.
And for us, Somalia, we have a program called Female Health Worker. In the Somali language called Marwa. Like it's community health worker that's dedicated to provide basic health services. They, as my colleague mentioned, they have a digital mobile phone with an app in the dashboard. Then in the real-time reports to the DHI, to all the health information management system.
Okay.
By the time they interact, they are in the rural area, they are in the inaccessible areas, they are far in the remote areas. By the time they report, it's fixed in real time at the data center. So we have deployed 2,400. Well, now we have almost the first phase and second phase, almost 1,400, and another 800 is already on the way. 2,200 almost female health workers are deployed across main regions in the country. The aim is for those who have areas with less access or there is no health facilities to provide the basic health service and transfer to nearest health facility and report in real time to the HMI system. So I think
the experience is similar. Yes. Okay. And that is why we think that as Africa we can have a similar voice when we go anywhere and bring over. There are quite a number of community work is something that Africa should export to the whole world. So that's my personal conviction. Anyway, it's dinner time. Let's have your final words and then we can wrap it up. We'll begin with her.
I think as we all mentioned, we have an important step with the adoption of compact. But now this is like the beginning. Now we should act and implement it. I think we are in the way. And digitalization comes with a lot of hope, a lot of fear, but we should work to make the hope higher than the fear and make all people benefit from its potential. Thank you.
Okay.
I think not only for me as the Director General position of authority, I see the digital health solution. I think a game changer. That's why I always promote to digitalize initiatives that we see as a low hungry, which we can make it possible. And in an era we have now digital global digital combat adoption, I think we can finalize. And deploy more digital health solutions across the countries and the continents.
Thank you. Dr. Tiranira.
So thank you, number one, to that question. Majority of the community health promoters in Kenya are women. So that's sort of happiness.
Yes.
So first, I want to say thank you very much, Transform. You have really been supportive. Medic Mobile team, you have done amazing work in Kenya. Keep it up. Keep it up. So more importantly is that we need to work together and make sure in all these places that you walk into, invite teams that can encourage others. Let's continue sharing experiences. I've learned a lot. I was writing notes. I have some homework to go read about Somalia and from Burkina Faso, because there's something I've learned from them that we need to take a corner somewhere and correct those things. So the more you share experiences, you might be so far away, but there are things maybe you missed or things you need to correct so that you move fast. Thank you very much, and thank you for being an amazing moderator.
Mesdames et messieurs, c'est fini. Thank you very much, Your Excellency. We are grateful for your input.
Thank you, thank you.
Mr. Chair.
Thank you so much.
C'est fini.
C'est fini, merci. Yeah, tous. So thank you, Nina, so much for, excellent and as always very passionate, moderation and sharing, and for all the contributions. I don't know whether you would agree with me, but I really feel this was an extremely interesting session for me this afternoon. I've also learned a lot, and it was really inspiring. And sometimes we are in UN week, right? Many of you are tired. We've been through many days of endless discussions and sessions, and you come, wow, 2 hours. Yeah, that's a commitment. But this was, I think, time well spent. And I won't try to summarize everything, but I want to share some observations with you. So on the first panel, the voices of civil society and young people, I think there was one very clear message. We, as young people, we are aware that every health system in the world collects tons of data, but we want these data to be safe and protected. And we want to have access to our own data without discrimination. Then when we had, the senior government officials here, I felt there was no difference in the direction, right? It wasn't that you were coming from a completely different direction. You also want, data to be safe, accessible, and kind of really mobilize the huge potential of the digital transformation that you all mentioned. And often you already have the first legislation and acts, and I understand from Kenya, you have plenty of acts already there, right? However, you also recognize that this doesn't solve all the problems yet. There are still lots of problems, right? From literacy to finances, from what I would call lack of digital public infrastructure, and what I've heard again and again, and particularly also from Honorable Minister, the lack of interoperability. Now, nobody should think here that this is an African problem. This is not a problem of financial resources. I don't know any country in the world, maybe except for Estonia or some smaller but very advanced countries in this, that have solved that issue of interoperability. I know hospitals in Europe, that have 800, programs, software systems that are not talking to each other. So don't think for a second that this is just, because there's lack of capacity. This is a global issue. So we have lots of challenges. The vision, it seems to me, we are not far apart at all. So now, what can we do to get there? That was the topic here. And you asked me, and I speak, on behalf of the board of Transform Health, the whole partnership, and the secretariat. We are fully committed to be with you in making that happen. And there are a couple of positive things that were also mentioned. We are coming out of this week with the Global Digital Compact. It's a foundation, right? It's not everything, but 193 member states of the UN have agreed to that. That's a starting point, right? We have heard about several events that can be stepping stones for that. And we all heard the invitation to Kenya on the 4th of December. I remember that, right? I mean, the global, what is it? The Global Digital Health Forum, right, in Kenya. And it was fantastic to hear from you that there are not too many government officials who are also passionate advocates. You ask for people to come and scream and shout, right? And demand their rights and move this forward. Thank you for that. So I think many will come. So this is the kind of forum in Kenya, but we are also already looking at the World Health Assembly next year, organized by WHO. And of course, we were looking at Derek. Derek was looking at me, but together, Derek, hopefully we can make it happen, right? I mean, we want to bring this to the attention of all ministers of health coming to Geneva every year, but particularly WHO 2025, to move this forward. And Transform Health is helping by providing the input, the kind of technical support for that, with the kind of model law, data governance principles. They need to be adapted nationally, regionally, and so on. But I hope at least it helps you have a better starting point. Some of the issues that you mentioned, the lack of, digital public infrastructure, finances, and so on, that cannot be solved just by Transform Health. But I think if you see all the partners here, they all have different roles in that, right? The WHO, of course, has a big role in that. Health Data Collaborative, OECD, PATH, I know PATH is providing, big support in a number of countries, technical support that is also required. And there are other agencies, institutions, members of Transform Health or not, who can provide that type of input. But I at least leave this session much more encouraged that it can be done, that there's a lot of goodwill here. There is the demand coming from civil society and from people at large. I would say, populations are demanding that. They see, I think you said that very well, Honorable Minister, you see the opportunities and you see the risks, right? We want to minimize the risks and we want to maximize the opportunities, right? So that's what we've been here for. Just thank you again for all these contributions, the moderators, the speakers. It was a very enlightening session, I would say. Helps us to move forward as a partnership. And then, see you again in Nairobi or in Geneva or in New York or wherever, we might come together to take this forward. Thank you all so much. Have a lovely evening. Thank you for your stamina and patience and staying here through this long session. We have a picture now. Request to all the kind of speakers, panelists, please come forward for a picture. But otherwise, wish you a wonderful evening. Have a great kind of end of your stay in New York. Safe travels home wherever you go, and hope to see you again. Thank you.
Thank you.
Gracias.
Who's making
Thank you for coming. Oh, I thought everyone was joining us.
Everybody.
Please join.
Speakers and moderators.
Okay, first.
Yeah.
Done?
Oh, she's taking several.
Derek, yes.
Eric is the main man.
Here we all turn a bit.
Okay.
Thank you so much.
Merci beaucoup. Asante sana.
Asante sana, merci beaucoup.
Yeah, so I work on a person.
Then they track that data.
Thank you so much. Thank you. It was a pleasure. And this was really a very
We are doing a lot.
You are doing a lot.
We have to run. You read our story, we are now thinking to procurement.
No. You know what? Kenya.
Yes. You know, our geopolitics. That's a tender of I don't know it's out there, it's
And all the best, huh? Thank you for what you're doing in Kenya. So next step.
No, but say hi to you. Yeah, but I know. So I told Joe, you are here. I told me your friend. He's the one lead with the project lead. Everything was perfect.
I got one right here.
So he was there. So now,
Okay.
so now, and I will make sure I want it to be as big. Some and others, you mean health president? So it's coming to show.
Yeah, that
Yeah.
Your journey will be very good. You will reach there. You will reach there.
Would you care joining us for a picture?
So that's fantastic. Yes, you guys are just I don't know, I feel what I get.
You can also join the them.
Hi, how are you, Sarah? Your colleagues at NAPSTOP. I love you. The AI program at my dime. Yeah. So this one is
I give them
And yeah. Are you digitizing your pharmacy? Yeah, we're working on it. Yeah. And we also cover vitamins. Yep. Are they sending all their emails? Yeah. Yeah. Thank you. I mean, obviously. Yeah.
Just you.
Yeah. Yeah, it might have been.
What's the illustration? I just saw. I just thought it was just
You feel like you get he was asking us such intelligent questions. He gets the reality. Oh, but we probably already talked to you about much.
Let me pick my phone.
That's already in our head, but they're in a lot of it. All right. I said we'll talk tomorrow. Bye, we'll see you in the morning. We'll see you in the morning. Having breakfast. So be there. Be square. Yes. Okay, yes.
Yeah, hang on a minute. I gotta.
All
right, got it?
I'll see you tomorrow.
We'll see you tomorrow. I got to frame everybody to recognize them.
For sure.
Yeah. Did I tell you about that one? Yeah, I did. I mentioned it when I ordered the.
Yeah. The model law, yeah.
I said. that suit
Yeah.
tailored to the exact specifications of Daniel Craig's suit.
Yes, yes, yes.
And the scene of the remake, the scene of
Yes, right.
which is where
Mhm.
it was only.
The organizers have microphones.
I got a lot more work to do.
Yeah.
Nearly as-
Yeah. Yes.
I'm sorry. Reminded me of a friend who I one day Thanksgiving 15 years ago. I was completely disoriented. And I was like, oh, that's Jessica. There we go. I'm so sorry. It was surreal for the first time.
Yeah.
I was so exhausted. I'm so
I
sorry.
know.
There was no-
Yeah. And we always make that happen. Yeah. Take my card and then sorry.
I'm so sorry.
What about you? Okay. Okay. Well, the thing is, logos, we have people everywhere. Yeah.
Amazing. Yeah, I mean, would it be great if we can, like run some of the, email topics like you made.
Yeah.
Policy.
That would be great. Yeah. Yeah.
Awesome.
Thank you so much.
And thank you
Look forward to continue the conversation. Yeah.
Likewise, I didn't know there was already global, diplomacy initiative on this.
Yeah. Yeah.
It is great. And they have the young experts take for help.
Yeah, yeah. So they have been with us from the beginning, actually. They are like they are a sister network.
Experts, yeah. And that's model four, where do you want me to go? Like, what is a?
So right now, it has been, so we work with the Africa CDC in implementing it, in developing it.
Yes.
And the idea is then to get it endorsed by national governments. And for them to actually take a board of the blueprint and to further develop their inspection and make sure that it's health specific and evidence-based and so on.
Interesting, why Africa? Because
No, it's not just Africa, it's actually for the whole world. So we also do a lot of work in Asia and Latin America as well.
I see. What about India?
No, we don't work so much in EMEA because it's also because of funding, just in terms of the priority regions that we decided to establish us from now. So we have like 6 priority countries, and then we also work in West, East, South Africa, and Southeast and South Asia. Yeah.
It was so many personnel.
And we have Mexico and Kenya, Senegal, India, and Indonesia. Yeah. Well, nice to meet you.
Likewise.
Thank you so much for coming.
This is just the beginning.
Yeah.
So I will follow up via the email.
That's great. Yeah, take care. Okay, bye. Thank you so much, Sarah. Yeah, it's okay. We'll follow up. Yeah. Have a follow up for one. Yeah. I didn't know that. Did you get the flyer? Do you have the flyer? It's kind of, sorry, I feel like that's cute. But yeah, just think we want to have that one. No, I mean, one of the, yes, we want to know, right? It's good to use the government. Thank you so much. And thanks for making that initiative. Great to elaborate. All right. Thank you.
I just almost my talking points for tomorrow. Maybe hopefully that makes sense. I'm just saying, I'm like talking how I think this all could have been.
I'm so glad I'm not doing that. Thank you so much for having me. I had so many things. I'm like, no, I don't do another one.
Like, wait, there are some talking points.
but I don't really like to kind of pull together stuff. So I'm like, I need to read through that, but then I was like, that's my homework now when I get home, is to make sense of what I want to say. I do think what's actually really interesting, which is giving me confidence, is we did one of the last year, we did one of the national consultations to interview how there was someone from the organization on the but he felt and he was saying things like farmers and they don't want to shine. Therefore, so that people because of which I think that it's from, but then there so it doesn't make sense. So like there are a lot of similarities.
No, I guess that's like, I mean, it's in there,
yeah.
Yeah, right.
Yeah.
She makes those questions, but then like, it doesn't sound questions together.
Yeah, how I to like the stronger.
Like the ask.
Yeah.
I am so tired.
No, I say this very much, but I want because you're both. Because the forward journey, I'm sure. The reflections people
But she's
so that's not, sorry, but there's no, there's
I just assume naturally quiet. Thank you so much. Yeah, that was amazing.
Say that.
I haven't had it, right? Yeah, I have some Did you?
I had before we started.
So to get the system to work,
yeah,
you need to take this. Not the most attractive. Now,
Yeah.
are you going to be?
So they're putting the big board table back in again.
That's fine. So then this table will park right here. So if you need a laptop, we just plug it into that. Now, you use that camera for this, so it's all encompassed. Did you want to use your own camera?
No. What I'm trying to do is trying to make this room as simple as possible from a video perspective. But they do want to be able to click along. So, yours. Is that your laptop?
Yep.
You're not using it?
Yeah.
No.
That's how we do it. It's just
So much bigger without the table.
I might have just saved you a headache.
Okay.
This man has a laptop.
Okay.
That is all they've asked for in this room.
I see.
And if we use that and that, this is no longer a Gil problem.
No longer a Gil problem. But wait, but what about the Zoom that you have and all that?
Well, Zoom, they're joining us. So how does that work actually in terms of how did one of you guys set the Zoom meeting is?
We started.
Yeah.
And they all join.
Have you got someone?
What time? Well, Evan will be at the front desk. He runs this floor.
Oh, cool.
So he'll be around. If something bad happens, I'll come running up, but he's fine. So the tables are in. This table is gonna be here, connected to the floor. This will be on the table. Where are you presenting from? Around the room?
Mainly from the table, but sometimes from the podium where you're standing.
All right.
Or there.
Now,
wherever.
What I would suggest, if you can, well, one of two things you can do. You're gonna have to change cameras on the touchpad. Because if you want it, or if you want to just do it all from that camera, what we usually do is we'll park the presenters over here. And we'll have that camera down, shooting them. There's a camera in that.
Okay.
Okay. So that'll be down, angled over here, and then we would have that camera shooting the podium like it does now.
Yeah, let's just do that.
Okay, so, but then you're still gonna have to have somebody from over here. Change your cameras.
You will have a tech, we have the crew, yeah, we have a D1 for this group. And another one.
Well, the A's got that job today.
Right. Also, are we swapping out so
the podium's gone?
Yeah.
Okay, good.
I'm just trying to think sorry, I just had a chat with a client.
Mm-hmm.
They want, all they need from us in here is a laptop with a clicker.
Okay.
Which is that.
Okay.
And I just kind of thought, well, we could make this really bloody complicated, or we can actually just go with what's here that works. And
that's what we've done this week. This was the floor. We're like, look, it's as simple as it possibly could be. Don't make it any worse.
You don't need the backup. Yeah, I think so. So our part will consist of just camera switching. What is that for?
it's only really that one camera.
So there's no camera. There's two.
Yeah, we'll just use that.
And then shoot the whole table with
yeah.
And you have it set up for the Zoom caller to go on the screen.
That little box is Zoom call. So that's what they would see. If you're presenting their full screen, if you're presenting, they go up there. If the person starts talking, and like $5 up there, they'll just.
So, and when tomorrow is that all gonna get set up? Or is it already set up? Oh, you just need a person to operate.
Well, what time does it start?
In here, 11 o'clock.
So we'll start at 10:30.
That might be live. Sorry.
We'll start.
Or is it 11 o'clock? I'm not sure.
Whatever time you want it to start, whatever time the calls start, they should, like, your meeting starts, the call should start a half hour.
Okay, so the two Zooms are the afternoon sessions, so between 2 and 6 are the two Zoom calls. The rest of the day would be just showing presentation, and you don't do that via Zoom, do you?
No, by the end of the share.
Yeah.
I have a simplified.
No, you.
Scott, you're happy, or you?
Yeah, I mean.
What I usually do. So I have my, I have a little task.
Oh, well, there's no.
Yeah. No, you still have 4 TVs, or you want 6 TVs out there?
And that's the sound, that way the sound gets throughout the room, and throughout the system.
Is that like Dante patch?
Yeah, it goes into our wrap.
What is it, a Dante patch?
I believe so.
Okay. You could probably use our console that we brought, that is Dante as well. And it's just so different to that.
Yeah. So like I said, the task is gonna have is just some analog board they had laying around, so it's just.
You're A1 I think you're A1 for this.
No, I mean, the whole feature, they've got Dante here. So if you plug in, maybe you can see it.
Yeah. Give it a shot. Jordan?
Yeah. So, who is setting up this room with you? Is it?
At this point, Any of us?
So we should migrate that team into here and.
Are you gonna be in the room?
I won't be running it, but I'll be here. And the board will grab now. How many are you gonna do tonight? Very cool, so we'll see if we can get that started. Yeah, sorry. Yeah, we need those, and then plug in from the laptop. Okay, so I can do an additional speaker and so. So 3 TVs showing so TVs and and also showing the settings. And slide. Okay. If you want to. Yeah. Yeah. Okay. Yeah. Yeah. Sorry, Greg. Where to?
I don't know, it's really hard to say, no, this is so complicated. It's really hard to say. Giving it no.
Good catch. Yep, and then a big ass table here in the middle, and then we're swapping podium. First, control wise, I guess.
Yep.
Baby in the corner.
Because I mean, it looks like this is how they control shit.
Oh.
So, yeah.
Again, I have XLR to go anywhere, but yeah. So then let's move these cases to the back, that back corner.
So this is gonna be on tables, right? There's gonna be tables everywhere, yeah.
Yeah.
Yeah, I've done this once.
Yeah, I've used a bunch of wired pusher tops. I've never used a wireless one.
Yeah,
before.
it works good.
Yeah.
Why are we expensive system, but so nice.
I'm sorry?
I said, why are we providing it? So nice.
Oh, yeah. I mean, they just mix that with
They cut it.
No. No video is
Sorry, they're paying people in house.
So we're still operating and basically the V1 is gonna be the stuff, which is basically electric cameras and stuff.
Okay. What about the rooftop? What's their decision on what they're using up there?
I don't know if
So, right there. This is where they're really going. Right here. Okay. So right here, there's. Okay, great.
But that's the next. So.
Where's how it's still running through a house, like where's it? Oh, why don't have to spot? Okay.
So then when they're done.
You do it, makes sense.
Yeah, we have 30 minutes. So, and then they'll, hello, do you need someone to start snapping here?
No, I was just looking to see how much control we had over the last. They were high, low,
Are you
back.
trying to do it over there?
Yeah.
I think they did them.
Yeah, they did. It's fine. That's fine. I was just hoping that you could turn off the outgoing lights and then keep the down lights on.
So hopefully we can. Yes, Fred. Fred is lighting guy.
According to the buttons, no, you can't. I had high hope you can look up.
I'm so sorry. So we're just like stacking two.
You're just trying to be helpful.
Yeah.
I'm not stepping too high.
His eyes taking it up.
Oh.
Thank you. Should we put it on the V0, right? We're gonna struggle.
Helpful. I can keep it to one corner, so they have to be less alert. I don't know. Maybe I'm so many things to do.
Yeah.
So, you know,
So that we can feel like we're making some progress.
I feel like things are going some.
Try this.
That's seating, we'll know what to do with that.
Yes, that's gonna go back. Perimeter.
I know.
I think burgers, but like maybe Hellstone.
I have to order off of my Uber Eats because that's where I have my grocery card. Well, I don't have it on me.
Okay, no, we don't do that now. I'm just fantasizing about it.
Well, let me know when.
Hellstone.
Hellstone, they don't. I would love Hellstone.
Right?
Do Hellstone.
Yeah, we're like, hey, you guys got this?
I mean, you know. I think they shut down.
No, this one's gonna be out.
Oh, trust me, I tried.
I don't want to touch anything on there until we. Right. No,
Keep thinking about it. One nice, keep me posted. You know,
We could do a huge crazy steakhouse. Like, what could we do? Just like the nicest restaurant. Like, guys, what's this for $500?
okay, good.
Oh, that's
no, and I think you can tell you that table can't really, ooh, too much.
Okay. Okay, and we'll let them do it.
Yeah, we don't.
They'll take out
Way to
the
hook
stage.
up
Are we using stage shows for anything? Not certain, this is the state which one.
Oh, this? Yeah, I'll talk to Mike.
Well, on the other one, they had this clamp.
Bringing their own, so we can.
Yeah, I did.
The dough.
It's in the box.
It's in the other thing, the other box, in the other microphone.
There's one right there. It'll set this room, sorry. If you want to check that, I will grab some like supplies so we can wipe this thing down. And then I think. We need, people to check around with it.
Yeah. Yeah, so three there.
Yeah, how do you touch this? Oh, through this.
Okay, let's use another one. So, 1, 2, 3. Yeah. Column, center.
I'm not at Broadway, I do off Broadway, and regional theater.
Oh,
Off Broadway and regional theater. Nice. Let me take a look at it, not even what's the. That's not bad.
So these each get a separate signal.
Are we gonna shoot today? I have no idea. I don't work for I'm not Frost staff, so I don't.
oh.
Who do you work for then? Well, I work for Frost, but I'm not their staff member. I don't work for them full time.
Oh, sure,
I'm
yeah.
just,
you're a
I'm just,
freelancer.
yeah, I'm just
Right,
overhired
yeah,
for them.
Well, I see what you mean.
Yes. So I know none of those details. I just know we're here. That's all I have.
Right.
Same here.
Yes, it's 1.
Oh, this are good pretty well.
This is gonna be weird. Maybe this is wrong.
No, 4 is over there. And then.
You have it right.
Not really, because it should be like that, right?
It's that one. Oh,
Be like that. Oh, loose.
Hold on.
You need, yeah, it's just nothing. Anyway, so we need quick copy, so long. But I have a screwdriver. Oh yeah, but it's not gonna do. Yeah. We need, how is it called, this one? It's metal.
Yeah, the stopper, that's what I thought this was.
All right. Close. Well, maybe we can just bend the thing. Let me see, I got an idea. This first. Let's just bend it here. Go like this, look, like this.
Yeah, but they'll be different now.
2, 4, 5, 6, 8, 6.
Size, please. Let me just tape it. Woo, that is dumb. Yeah. I have this screwdriver. You get it. Okay. Oh, here they are. Just a work. You want a screwdriver? If you have one handy, sure, or multi-tool, sure. I do my bed. So I might be able to like counter this. Very good. Very good. This switch. No. There you go. Oh, she's my text. He's my favorite part. What's it? It's my favorite part too. It's gonna be the same. So we need to go closer. All right, let me go get the rugs.
So we're networking.
Or we can, or like this. It's even better.
Our office is the right, that's where he. That's where they're based at. So I go store, and the office to the right.
Well, once they tied together, it would be okay, right? I think so. That's yeah, I think that's the only thing we can do. Yeah. Because they're clearly made to be like this. Thank you. It's
So this is going to be the networking. Each has a whole package. Everyone, this is the boardroom. All of the things are in. This will open. Yes. We're not opening the door. You don't get speakers. We started like. Yes.
That's a lot better. Oh.
The security for.
I'm not figuring out. That's a good. So I guess if we want to try to put up the other mic and then we can start doing that.
Where is it?
It's right here. Right, so we'll start looking at the sound speakers. See the holes that we pulled out. Like sound feel good. They don't leave some of the trees. Yeah. Oh, there it is. J8s.
Or is it the Maui? Huh? The Maui, or the Maui on the roof, no? The Maui speaker.
I think this, that's not the version. This is just J8s.
Make sure that he likes that.
It's DLC Maui 44 G2s. It's the one.
Maui here?
Yeah.
Oh, yeah. Those are nice. You heard them?
I have not. Listen to my knowledge, I have to see it. I'm better on the visual than I am on titles, which is unfortunate, but it is accurate. Let's get those cases on, and then we'll open up this. They're just stacked. I'll bring them all to J8s.
Here he is.
These are subspheres, just the J8s. I
see there's a top that goes with this.
It just says the two RFC. There's a second.
There must be a top that is in the case. Oh, it's in there.
Is it in the back?
Yeah.
Okay, great. Because I was like,
I remember I saw that. It's in the back. Let me get this out. Oh, yeah. There we go.
oh, amazing. Good. Because I was like, oh, really? Yeah. That's what we're gonna do though.
Yeah, because I looked on YouTube. Yeah, really fun. I guess we got two. Is it two or one?
I think it's just the one you should extend it up.
Well, yeah, you. There's one just on this. Okay. It's two.
It's just, I mean, they always are, but.
This goes to this.
It's pulled up.
It does?
Yeah, just now. Oh, it's because this is taped.
Wires.
Definitely. Yes, out of it, so it would slide. Mine did, so that's how.
Oh, you did?
Yeah, mine slid.
Oh, I see.
That's how I know it has to. But I don't know anything else beyond that. That's a little.
Oh, yeah, you go. So, oh, shit. Go ahead, just, I'll get the key out of the TVs together. Press the wires through. Down signal here, and then on the bottom. And, hook the laptop up, I guess.
So this is why it was taped together.
One laptop.
I guess there's a lot of.
Here you are, screw this.
Back down to switch.
Oh, that's
fine.
great. Yeah,
Yeah.
cool. I don't think it's doing, I think it's loose. I think there's something there.
Oh, it's the.
I have a small plier. Shall we do that?
I think he's still right. Here.
It's gonna be posted. This is the large meeting.
Okay. Is this where I was?
Stakeholder forum, all closed door meetings are happening in here. We're having push to talk microphone on the table in here. When Rocky, don't get comfortable when Rocky. So this is the closed door boardroom for all of the closed door meetings. The patch event, the convening, the Quincy event, the stakeholder forum. I'm missing one, the ERM event for 2 hours.
Can I ask a question, Jill? Is there any chance you could just send a list of, I think Laura may have asked, of the ones that are specifically closed doors, so that we can make sure the press don't have access to them? And doesn't have access to them, because I don't think.
Yeah, I'll send you the same packet that we're printing out. Hopefully Sumitra gets here and then I'll send.
Am I right in saying it's fair to say that if they're in a room that's got a door?
Yeah.
They're closed door, because the only room you just in, the big one and the one upstairs.
Yeah.
Is that right?
Yes, and the benefit is that each of those closed door sessions has a team that's leading it.
Okay.
And so they'll manage.
Yeah.
They know who's coming in and who's not coming in.
I just don't trust it. It's not like, oh, I'm in a room now, you know, like.
Who is leading? Are you leading on this stakeholder forum just to make sure that it's set up?
I will help. But Lydia is.
So I have name 10 cards for a stakeholder forum. So if I give them to you tomorrow morning, can you make sure that?
Also, yeah, she's going to well with.
Okay, so can you guys work together?
Let's do so.
Okay.
Yeah, because you're doing your bit, but yeah.
Yeah, because I will have the 3:31.
Okay. Okay, so that's this room. If you want to go and look at the 14-person one, we can just walk around here. Yeah.
Okay. Yeah, pretty good. Alright, 3 or 4? I had, you're the right point, I remarked it, you're 3, we're 3 above. You, no. Say by 0 like this, or do you want? This one's also perfect. Okay, well, here's some screws. Rough looking. Right. I would say the pillar. Actually, I don't know. There's gonna be a table in the middle, right? That's what he said?
There must be a big table because all this.
Yeah, so let me ask if they want these up. Okay. Thanks. $15. Actually, no, it's. Oh, stick is fun.
Okay, so this is.
Well, I need to put that. Well, I didn't know if it was that system. I think it was this system. It's very expensive.
Oh, yeah, no, these are, so for a,
20 grand or something. It's crazy.
yeah, the newer ones are priced out at 49,
Oh, yeah.
49.5.
Yeah, yeah. So it's probably 30 something. Because I remember the guy who bought it. So that's an investment, I guess.
So I was a field services engineer with AVI SPL for a little while.
Oh, okay.
So like this whole skyline of
Oh,
towers,
okay.
I've engineered.
Oh, I see. Okay.
And all the corporate and honchos and everything.
Right.
Every conference room when they're having meetings about being masters of the universe and congratulating themselves on all their money.
There you go.
They like using these.
Well, we like to sell it to them.
Exactly. Yeah, these are.
Is it?
There's two little notches that are in there.
Oh,
Yeah. And you literally just slap the battery in these guys like a clip.
So there's.
So I'll just line these up on these benches as they go. This is where the AV crossover comes in.
So we're gonna, just so you guys know, one of these is gonna go down here in this corner, and then the other one's gonna go back by front of house. And basically it's just a giant table down the center here, so it'll be one on each like up to that. For speaker wise.
Yes.
So I think it's really an amazing way to like speaker distance tell.
Eat it.
Yeah, I feel like have some like. Speakers, we're not time to.
Oh, we very easily could. Like those right there, that would, honestly, this entire conference room is, we could patch right into the Dante system that's in our AV rack.
Yeah, I was like, I feel like I mean.
I've engineered this exact floor to floor
Oh.
with AVI SPL. Like it's, this, I know where their AV rack is. I know where all their equipment is.
Might that be way easier?
So much easier, but no. Yes, that we can't. Two different markets. AVI SPL is never gonna let somebody in one of their racks to a public event. And they would never want to use in-house equipment that's already here because that's gonna take away from what they're spending on rentals.
Yeah. I mean, they got the TVs over in this room, and everybody was real happy about it.
Oh, wow. Oh, yeah, no, we could have very easily, like, this is, so that's coming out of the corporate sector. That's like what I was doing was I was a field services engineer with AVI SPL for a while. So we would handle all the fucking the towers and all the corporate offices and.
I guess we put the lid back on this. Should we hook up the thing? But this can be the table for the console. If we're gonna get a second one. Another power. Oh. Yeah. And we'll put it back there. This can be the table for the console. Where do you? So, what's up tomorrow? Also, here we're drawing power for that. So I just kind of thought about that.
Probably from under the cabinet. Yeah, actually, what are they running in here? Is this Crestron? It is Crestron, no. WebEx? Crestron.
It's called started late, it just already feels like midnight.
I literally just informed Mike, like I have a suit in my back because I didn't know that I wasn't mixing this. I've been under the impression that this event is going to start at 6 o'clock all
Yeah. Yeah, that's wow, that's how little information I had.
Yeah, nobody had any phone us.
Is this your first event, Frost?
First.
Third.
Yeah.
It's not usually this bad.
Annual. You said we needed that.
Cute. They were pretty well.
You two. So it's in order now. No.
Cute little plane.
What's
up, guys? Hey, there. Quick question for you. This room here, do you guys know anything about the programming that's happening in here?
There's a table.
Yeah, that's as much as I know. So.
There's a big table and it's conference with Zooms.
Zooms, okay. Is that Zoom call an overflow from upstairs? Is that?
No idea.
Okay.
It's bi-directional conversations. I know that much.
Within this room. Okay, all right, cool. Thank you, guys.
Oh, you. Thank you.
Oh, hell yeah, banana.
Okay. Soup and sandwich. The sandwich. Oh yeah. Chicken bacon. Cheese. Italian. Because I brought a suit instead of a laptop. Can have both.
Yeah, but there's special software for these to get more
Oh.
than I have, but maybe that suit they're so fucking hard for can do it. We should be able to get these going.
Soup and a sandwich. So that's my. I feel like that's.
So I tried to order, and I think because of whatever was happening, I think I'm going to get a sandwich.
Oh yeah, can't see any soup. Whatever. Oh, it's. My God. Yeah, I'll do that.
Yeah, we're gonna solve this. The big problems here. That's my goal.
Do more caffeine, that's the issue. This done, so we just select done, remember. And I'm just gonna say that's it. That all I need to do. Ooh. Yeah, that's good. Oh, that's rolls minds. These are all wireless to the access point, right?
They're wireless to the base. The base is connected to the access point.
How many access points do we have to have per transfer receivers to, you know? You know how many access points we need to have per research? Number of bases.
No, just one.
Oh, okay.
Yeah, it just needs to be on the same IP and subnet. They roll in.
Oh, so it's just the one from the station to.
Yeah, so this gets its own IP and subnet, and then these get programmed with their own IP.
Yeah, but
the same subnet.
It just needs two lines on one in, one out to the antenna or whatever, the access point, then the XLR.
Yeah.
So we just need to run two lines from the D. Oh, amazing. I was ready to run 16. I was
No. Three at most.
Hell yeah, wins.
Yeah, but also like these don't patch to XLR.
No, the access point has one.
Oh, gotcha. Yeah.
Because I assume that would transmit the ins and outs because they each have a little.
Oh yeah. You'll get all of these off of us.
Yeah, but that's way easier than running all that fucking cables that's prepared for.
Oh yeah. That's why these are great for corporate, like these, the Masters of the Universe meetings consist of these.
This reminds me of like the UN Nations record sheet.
That's basically what these are. These are for.
Well, I need them to bring in a fucking cable suite. So.
Well, the setup's also gonna be like way faster and easier than you would think. Like they use these for. Usually these roll around on a cart in these buildings.
Yeah.
There's an access point built into each ceiling.
Yeah.
And they roll the bases around on like a wire cart with battery on the bottom, and they just. Every time there's a meeting.
So what do we should get the XLR kit down here. And we could get throw a couple power cables on that bit as well. We're gonna need power from front of house. Then we'll need to run power around for the speaker over here. And then I don't see power underneath. That's unfortunate.
Oh, we're also gonna need a switch.
Oh, what's that?
That's right. There's switches.
Oh. These are all in the fucking middle. Oh.
This white tape.
Oh, you fucking.
Oh, you guys are on the call?
Or is it still from the last one?
I have no idea. We are not running anything.